Well, welcome everyone. We're going to get started. My name is Kim LeBlanc, and I am the Academic Chair for Nurses Specialized in Wound, Ostomy, and Continence Canada. And it's with great pleasure that we welcome you to tonight's event. And we'd really like to thank Monica for sponsoring this event. To kick it off, we're going to invite Nicole Kokajda from Monica to say a few words. Nicole?
Thank you, Dr. LeBlanc. Our first speaker is Corey Heerschap, who is the clinical nurse specialist for wound and ostomy at the Royal Victoria Regional Health Centre in Barrie, Ontario. Corey completed his Master of Science in Community Health, specializing in wound prevention and care, and the International Interdisciplinary Wound Care course, or IIWCC, from the University of Toronto in 2015. He's certified in wound, ostomy, and continence nursing through the Canadian Nurses Association. He also completed the second cohort of the CAET Building Leadership for Enterosseal Therapy Excellence program. In his current role, he works alongside the interdisciplinary team to ensure best practice wound care is being utilized throughout the health center through education, consultation, program creation, and policy development. He is the past treasurer of nswoc and current secretary of the Canadian Pressure Injury Advisory Panel, or CPIAP. He assisted with the development of competencies and exam questions for the CNA Wound, Ostomy, and Continence Certification Exam, and was in 2019 recipient of the nswoc President's Award for Excellence in Wound, Ostomy, and Continence Nursing. He has conducted and published research in the field of wound care, ostomy management, and nursing education. Currently, Corey is completing his PhD in nursing at Queen's University, focusing on wound care decision-making by registered nurses. Welcome, Corey. Our second speaker is Dr. Kimberly LeBlanc, who you just heard from. She is known globally as an innovative nurse leader. She is the current academic chair of the Association for Nurses Specialized in Wound, Ostomy, and Continence Care, nswoc, the Wound, Ostomy, and Continence Institute, and an advanced practice and certified wound, ostomy, continence nurse working with KDS Professional Consulting. She holds a doctorate of philosophy in nursing from Queen's University. Kimberly is an adjunct professor with the University of Western Ontario Masters in Wound Care program and an affiliate lecturer at McGill University. She's also past president and founding member of the International Skin Tear Advisory Panel and the co-chair of the Canadian Pressure Injury Advisory Panel. Kimberly has lectured extensively on wound and ostomy care and has numerous publications and book chapters on wound and ostomy related topics. She sits on the editorial boards of Advances in Skin and Wound and Canadian Nurse. In 2016, she was awarded the prestigious Canadian Nurses Association Order for Merit for Nursing Education, and in 2018, she was awarded the nswoc President's Award for her contribution to WOCC nursing in Canada. In 2020, she was inducted as a Fellow of the Canadian Academy of Nursing. In 2021, she was awarded the World Union of Wound Healing Societies Award for outstanding contributions to innovation in skin integrity at the global level. Welcome, and thank you both for agreeing to present this evening. Corey?
I'm going to jump in and start us off. Sorry, Nicole, but thank you again to Monica for sponsoring this event this evening. We'd like to start with a land acknowledgement. So I would like to say that, I live and work in the traditional unceded territory of the Algonquin and Anishinaabe people. The Algonquin peoples have lived on this land since time immemorial. I'm grateful to have the opportunity to present in this territory. Next slide. So for this presentation this evening, we would like to do some special thanks for their allowing us to use some of their work. So Professor Dimitri Bickman and Annika Fournier have graciously allowed us to use all of their PRONEtect literature that we're going to be talking about, as well as allowing us to give you the links that you can access these documents free of charge. And we'd also like to thank Julia Bresnay Harris, who is at nswoc, who's now living in the UK, who shared a lot of insights into her experience with working with COVID-19 patients and prone patients during the past year and a half. Next slide. So we just want to go over a couple objectives. So by the end of this session, we want you to be able to discuss the prevention and management of skin integrity issues frequently found among ill patients in the context of the COVID-19 pandemic. And these include some of the big ones. Now, anybody who knows me knows that skin tears has to be number one on the list, followed by moisture-associated skin damage, medical adhesive-related skin damage, pressure injuries, and device-related pressure injuries. And these wounds have really come into the forefront with all of the critical ill patients we've been dealing with. And it's really made us realize as a wound care community that we really need to pay special attention to our critically ill patients and their skin health. And then we want to take a bit of more of a deep dive into looking at specific issues related to prone patients. So with this, I'm going to turn it over to Corey, who's going to kick off the presentation. Corey?
All right, thanks so much, Kim, and thanks everybody for joining. I wanted to start off just before we start getting into some of the discussion today around wounds and skin health, to just say some of the information, or most of the information that we're going to be talking about today, comes from the NSWOCC best practice recommendations for skin health among the critically ill. And I just wanted to say a special thanks to all those involved in that document, including Kim LeBlanc, who you just heard from, along with myself, Julia Bresnay-Harris, Brittany Butt, Valerie Champlain, as well as Dr. Lauren Weisenfeld. We also had a number of peer reviewers, including Nicole Pitcher, Bart Hortikosian, Erin Rahathi, as well as Samantha Holloway. So I just want to say a special thanks to go out to those individuals. And with that said, I'd now like to move in to start talking a little bit about some of the symptoms associated with COVID-19. And then we're going to get into some of the more specific issues that you'll see with individuals in the critical care area. Over the last year and a bit now, we've really seen a huge spike in the number of critically ill individuals related to COVID-19. And in general, the ICUs have been quite busy lately, and it's important for us to really make sure that we're considering the skin health aspect to managing some of these individuals. So you can see here in front of you that there's a number of skin-specific discussions around COVID-19 specifically, such as symptoms with individuals who have COVID-19. You're going to be looking at things like fever, cough, shortness of breath, tiredness. I'm sure everybody's getting very well used to some of the COVID-19 symptoms that are out there, and some of the things that you're used to seeing now. When we originally did this document back when COVID-19 was originally starting back in May of last year, some of these were still just coming out. And you can see some of the less common side effects of COVID-19 that you might be hearing a little bit more lately. Some of the things like loss of taste or smell, we're seeing more with individuals now who have had COVID-19 and might be more of a after the fact type of symptom. But you're also seeing things that are a little less common, like abdominal pain, diarrhea, and some of the cutaneous manifestations we're going to be talking about in the next couple of slides. So specific to COVID-19, there was a number of case studies and literature that started coming out in the early pandemic, so early 2020. And we started seeing some of the individuals with COVID-19 presenting with things like rash, onset of hives. You were starting to see small blisters, just like you would kind of see with chickenpox, for example. You would see, like I mentioned, a bit of a rash, discoloration of the skin. You might also see petechiae, which are those small red areas that are kind of profuse around the skin. And now, although these are more specifically related to COVID-19, there is a number of issues related to skin that individuals with COVID-19 who end up in critical care situations where they're in, for example, the ICU, that it's important for clinicians to make sure that we're considering. And so some of that includes pressure injuries, for example. And we're going to be diving deep into each of these. So pressure injuries, skin tears, medical adhesive related skin injuries. So we're going to be talking a little bit about each of these and how individuals with COVID-19 are much more at risk for some of these issues, as well as a lot of these issues really apply to many individuals that are in critical care areas. For example, those in ICU where they're unable to move very well by themselves. They have increased in moisture because of the tubes and the devices being used to monitor them. They're at much higher risk for things like medical device related pressure injuries. And so we're going to be talking a bit about those moving forward. And so some of the common issues that have come up over the course of the pandemic, and of course prior to that too within our critically ill population, you see some of the issues such as skin tears, medical adhesive related injuries, pressure injuries in particular, and we're going to be talking about device related pressure injuries, but also following that, Kim's going to be having a discussion specific to those patients who are prone and how to prevent some of the pressure injuries from actually developing when patients are in a prone position. So of course, we must talk about, as Kim had mentioned, skin tears. Skin tears are a huge issue in the critically ill population. These individuals have very at-risk skin. These individuals are usually moist. It's much more likely to occur in a critically ill population where they have so many things going on and their skin is at much higher risk. It really puts the emphasis on making sure that we're providing appropriate preventative mechanisms to make sure that these skin tears don't develop, such as proper hygiene, skin cleansing, but also appropriate barriers and skincare every day. So in terms of the actual skincare piece, it is important to kind of have an idea around the skin tear classification. So this skin tear classification came from an article published by LeBlanc in 2013. And you can see this came out of the ISTAP classification, where it really broke it down into 3 different types of flap loss. You either have no skin loss, where the edge of the skin tear is actually right up against the skin. And in those cases, it may be able to be closed, and I'll show you an example of that in a few slides. You also have partial flap loss, and you can see that that's considered a type 2 in the skin tear classification. And in these cases, you can see that the skin tear flap is able to be partially affixed, but isn't able to cover the full wound. And then you can see type 3 of the ISTAP skin tear classification is the total flap loss. And that's where you have a total open wound and you don't actually have any flap to cover the entire wound bed. Now, in terms of who is at more higher risk for developing some of these skin tears, we already said in general, those in the critical care areas are more at risk, but part of that reason is some of these risk factors that you see in front of you. So for example, skin atrophy, a lot of the critically ill patients, especially when you think at the beginning of the pandemic where COVID-19 was particularly focused on the elderly population, you saw quite a few instances of the elderly individuals showing up in the critical care areas for lengthy periods of time. And those who are elderly are much higher risk for developing skin tears just due to the decreased thickness in terms of the actual thickness of the skin over time. These individuals also require assistance with care, and that goes back to what I was mentioning earlier with the importance of proper skin hygiene every day, making sure that there's a barrier in place. And we'll discuss some of those preventative and treatment methods in just a few slides. but also because of the medical adhesives. You have IV coverings, you have wound dressings. It's really important that we're considering on any critically ill individual what types of adhesives we're applying and making sure that those aren't causing trauma on removal. So making sure that we're very careful when it's coming time to remove them. These individuals who are critically ill have a lot of different comorbidities, and those definitely put them at much higher risk for not only skin tears, but a number of different types of wound from occurring. And of course, anybody who is requiring extra assistance, who is very unwell and in a critical care area, is obviously at a much higher risk for falls as well. Now, there's a couple of different strategies that can be put in place to prevent skin tears, and you can see that they become quite significant. You can see on some of the pictures here on the sides of the slides, those skin tears can be very, very significant when it actually comes time to manage these wounds. So it's much, much better to prevent, and attempt to make sure that none of these are happening to begin with. And like I said, there's a number of things that we could do to prevent those, and that includes moisturizing 1 to 2 types per day. And that, of course, depends on the type of moisturizer you're using. For example, the dimethicone skin products may last a little bit longer than your standard moisturizer. So, but it is very important to keep the skin well moisturized. You also want to avoid the use of strong adhesives on fragile skin. And I think that speaks for itself. You don't want to be using extremely strong adhesives on very fragile patient skin. And when it comes time to remove those dressings, any type of dressing, it's really important that you're being very, very careful when it comes time to take those dressings off so as not to cause a skin tear or any trauma to the skin. It's really important you're also doing proper transferring and lifting, so making sure that you're getting extra assistance when it actually comes time to move the individuals in bed or reposition. You don't want to be pulling the patient along the bed. You want to get extra support when you're doing even a boost up in bed, just to make sure that there's no dragging of the skin along the surface. You want to make sure that you're creating a safe environment. You don't want clothes or protective devices to cover the extremities. And by that, it basically just means that you don't want to have a lot of instruments or clothing or articles around and underneath the patient that can fold, that can cause extra skin creases and folds and create areas of pressure underneath the skin. And as I mentioned, you want to reduce the risk of trauma. And you can do this by keeping sharp objects away, making sure that the patient's not laying on any medical devices, and just making sure that that patient's skin is staying healthy. And you can do that just through nutrition, hydration, and again, proper skincare routine. Now, should a patient develop a skin tear, it's important that we're talking about management as well. So these are acute wounds, and you want to make sure that you're treating them in the appropriate way. You can see in some of the pictures below, not every treatment is going to be effective the same way for every skin tear. Depending on what's happening with the individual. For example, traditionally, wounds closed by primary intention might be sutured together or stapled together. You might also see steri strips used. But in elderly individuals, especially, this may not be the best method. And you can see at the bottom right there, what can happen in some cases where the skin flap may not take, or because of the tension along the edges, it's just not the appropriate treatment for those individuals. Now, that being said, however, there are other management options available. And you can see, for example, in a picture here where once the skin flap was actually reapplied, in this case, they were actually able to get this skin flap closed with a cyanoacrylate dressing or a skin glue around the area, which actually led to the skin tear to close over time. So there's a number of different skin tear management techniques. And if it does, however, come time to apply a dressing, you do want to make sure that that dressing is going to do one of the three things that you see on the slide ahead of you. So you want to decrease trauma, so you don't want it to adhere to the wound. You want to provide moist wound healing, and you want to manage pain. So you want it to be something that's not going to pull on the skin when it's time to come off. And you want to make sure that it's going to be something that's easily applied. You can see, especially on the picture over to your right-hand side, you often see patients on things like blood thinners, for example, when they're in critically ill areas. And in those cases, especially when you're dealing with patients that have very fragile skin, that can easily lead to blistered areas due to adhesives that are pulling on the skin, or where there are much higher risk for bleeding under the tissues. You want to be extra careful in these cases that you're using very soft dressings. Now, in terms of medical adhesives specifically, you can see here that it can be quite an issue. So when you're looking at things like IV sites where you're using certain dressings that you do need to make sure that you're removing carefully, it's really important that you're considering the risk for these patients for medical adhesive related skin risks. So in these cases, as you can see in the slide here ahead of you, it is usually recommended that if you do end up with, for example, like a skin tear or some erosion of the skin over time, and this continues for over 30 minutes after the device, this would be considered a medical adhesive related skin injury. And in those cases, it's important to make sure that you know how to manage those, especially because you're seeing them more commonly throughout those critical care areas. Now, some of the risk factors for medical adhesive related skin injuries include very fragile skin, of course, chronic use of adhesives in the same location. And you'll see that when you're changing, for example, an IV dressing or an IV site, a PICC site, those kind of things. Definitely if they have an allergy or a sensitivity to products, it'll start off as often one of those reddened areas, and it can easily end up opening up into a wound. Hair growth in the area as well, when you consider if there's hair in the area, when you're taking off the dressing and you're pulling that hair out, it's obviously going to put those individuals at more of a risk for something like folliculitis. And it's also important to consider any moisture that might be trapped underneath the dressing, as having that moisture on the skin over time can also cause some moisture associated skin damage as well. Now, you can see here a couple of different examples of medical adhesive related skin injuries. So for example, skin stripping, when the actual dressing or device is removed from the patient and it's taking that top layer of tissue off. You can also see those tension injuries that I was talking about, where if a dressing is put on too tight or the dressing is applied and there's some swelling which occurs and it pulls on the tissues and starts to create those blistered areas. And then of course, like we already talked about, the increased risk for skin tears in these cases as well is high. Now, in terms of dermatitis, whenever you have a patient that is using dressings or they're exposed to some external irritant, whether it be a dressing or something that their leg is or body is being covered with, are at much higher risk for developing a contact dermatitis, especially when there's moisture involved and sitting on the skin. You might also see an allergic contact dermatitis, and you can see in the picture, the second picture on this slide, where the area of hydrocolloid had actually around it started forming an allergy where you see that reddened ring around the dressing that had formed. Now, other issues that you might see, especially when moisture is involved around, for example, a drain site, or whenever you have a dressing that might maintain moisture and hold it against the skin, you can see maceration occurring if the dressing's not managing that moisture well enough. And then we already talked about that folliculitis and the importance of making sure that that hair is being managed if there's a dressing that's coming on and off frequently, so that you're not pulling all that hair out every time you do a dressing change. Now, in terms of management strategies, we already talked about the importance of making sure that you're not using strong adhesive products on very fragile skin. So you do want to use soft, low adherent products that are going to maintain a moist wound healing environment and decrease the pain when it actually comes time to take them off. So you want to use low level adhesives. You want to select a tape based on need. So whereas normally on a unit, you might go out, you might just say, oh, I really just need a tape. I need to hold this tube down. I need to hold the IV down. You do need to pay extra attention, because these individuals who are at risk are at much higher chance of developing some of these issues that we've talked about. And it's really important that we're considering the type of adhesives that we're putting on these individuals' skin. And it's really important we're considering that we're using the right adhesive at the right time. We already talked about the importance of trimming hair and making sure that you're doing appropriate skin health. So again, cleaning and drying skin before you're putting the adhesive on, and that just makes sure that the area of moisture isn't getting trapped underneath any occlusive dressings, for example. So again, another couple of management strategies, using films, for example, when appropriate. You want to make sure that you're allowing the area to dry before you're applying any adhesive. We already mentioned that. Talking a bit about avoiding those aggressive adhesives in combination with heat enhancing devices. Sometimes heat can really cause a dressing to adhere to the tissues, and that puts the patient at much higher risk for example, skin stripping, like you can see in the picture over to the right hand side. When the dressing was removed, that top layer of tissue came with it. And it is also important to mention that when you do remove any hair growth, that you're removing it in the direction of hair growth. Now, in terms of the actual dressing choices to make sure that you're preventing medical adhesive related skin injuries, very much so like we talked about, making sure that they're going to decrease trauma, provide a moist wound healing environment, and manage any pain that that individual may be experiencing. Now, moisture-associated skin damage is also very common in critical care areas, and it's important that we talk about this as well. So this can be in the form of, for example, perspiration, urine and fecal incontinence, saliva or mucus, very common, obviously, moisture that you'll see on almost any critical care area individual or patient. So these are common issues that a lot of critical care area clinicians face on a daily basis. Now, in terms of risk factors for developing these, obviously urine or stool incontinence, right? Perspiration is huge. Any individuals who are diaphoretic, where there's a lot of moisture, especially underneath, if you're not using the right products to absorb some of that moisture and wick it away from the individual, it'll stay underneath skin folds and it will stay in the creases and dips of beds. So it's really important that we're getting rid of all that moisture and perspiration that's sitting under your patient, especially if you're considering, for example, individuals with, like, for example, lower leg issues, where you might see lower leg weeping. You see more of that in individuals with, for example, venous issues, CHF, that's not very well controlled. Those individuals have a lot of wound drainage, and that can eventually start to cause maceration and tissue breakdown on the lower legs or anywhere on the body, really. Now, here's an example of different types of moisture-associated skin damage. So you may have heard of a number of these, for example, incontinence-associated dermatitis, and that's basically where urine or stool comes in contact with the skin and starts to destroy that outer protective layer. You may also hear of a number of others, such as intertrigus dermatitis, that you might see in those reddened areas and skin folds. Peri-wound moisture-associated skin damage, And you can see that around ostomy sites or wound sites where the urine or stool or wound moisture or exudate is starting to sit around the wound. If it's not well managed with your dressings, it'll start to break down around the wound edges. And then you may also see something, for example, like trench foot, obviously a little bit less common. However, when you do have, for example, an appendage sitting in moisture for a very significant period of time, you're going to start seeing that significant skin damage occurred due to that moisture. Now, you may also see some other issues that are a little bit more common, especially related to COVID-19 patients. And mainly because these individuals, when they get so sick, they're unable to move, they tend to perspirate more. You end up seeing issues such as incontinence-associated dermatitis. You see things like that intertrigus where they have inflammation underneath the skin folds and the breast tissue or the pannus, those type of areas, or especially around any wounds that may develop. Now, in terms of managing some of these areas, outside of appropriate skincare like we talked about, it's also really important that you're considering how you're absorbing that fluid, whether you're using briefs when out of bed, but under pads when in bed. So for those individuals in the critical care area where they may be incontinent, you don't want to be holding that incontinent effluent against their skin. So in those cases, absorbent underpads may be a better option for those individuals. And then just like we talked about with some of the other issues such as skin tears, appropriate nutrition and hydration and skincare is extremely important. And then of course, making sure that you're managing any fungal issues. So if the moisture has become a problem and you're starting to notice the spreading redness, and the areas of fungal infection, it's important that you're managing those. And you can see a couple of examples here on the slide as to how to manage that, or bacterial infections, either with organism-specific antibiotics, or if you're managing the fungal infection using an antifungal powder or cream. Now, in terms of other strategies that you can do, you also want to protect any of that denuded skin from further damage. And you can do that with moisture barriers. You can use pastes or powders. You want some sort of barrier that protects against the irritant, right? And so that moisture that's sitting on the skin, after you've cleaned it, after you've dried it, it's really important that you're adding some sort of barrier so that that moisture that continues to occur isn't sitting on top of the skin. So placing some sort of barrier on top of the skin is extremely important for these individuals. And then of course, managing those comorbid diseases and keeping an eye on the treatment plan to make sure that there is an improvement with the changes that you have made. Now, when you're actually cleaning these individuals and you're assisting them with their AM or evening care, making sure that you're using the right products. We've talked a little bit about now the importance of proper skin hygiene, skin cleansing, and it's important to do that with a pH balanced skin cleanser. So the pH balance should be around 5.5. And when you do clean the skin, it's important that you're doing a gentle cleansing. You don't want to be scrubbing very hard. You want just a soft cloth, and then you want to pat the area dry. You want to reduce skin on skin friction, and there's some dressings such as textiles that you can use. Some have a silver component to them and some don't. And basically what that does is it sits in the skin fold and it wicks away moisture from inside of the skin folds, and it prevents the friction and the rubbing against the skin. Now, you can see that there's a number of different categories, both for incontinence-associated dermatitis. There's 2 categories. And then we're going to get in a little bit in terms of the pressure injury categories as well. But you can see here in this picture a number of things that are demonstrated here. Everything from the pressure injuries that you see at the proximal area at the very top of the picture to the incontinence-associated dermatitis that's just in the middle left, to the skin tear down at the bottom right. So all of these issues you can see can occur on one individual, and it is really important that you're being extra careful. And we'll talk a little bit about as well some of the issues that you could see when, for example, you have a patient with a catheter, making sure that they're not sitting on that catheter. And you can see the device-related pressure injury over on the bottom left, where that catheter had actually gone under the buttocks and created that almost that channel of tissue damage that you can see there. And now this is a good time to move into pressure injuries. And so you can see here a definition of a pressure injury is a localized damage to the skin or underlying tissue as a result of pressure or pressure in combination with shear. So this definition comes from the NPIAP, or the National Pressure Injury Advisory Panel, who gets together with other pressure injury advisory panels globally, and they put together a definition and recommendations on it's not an annual basis, but every few years they do release a new pressure injury recommendation guide that you can refer to for information about pressure injury management and prevention. So talking a little bit about some of these stages, you can see here, many of you are familiar with pressure injury stages, but just in case you're not, I'll go through them really briefly with you. So you have your stage 1 pressure injury, which is just your red blanchable skin or non-blanchable skin, sorry. You can differentiate that from, for example, a moisture issue. So if you have a patient who's incontinent and you turn them over and you note that there's a new reddened area and you're wondering, is this related to the moisture sitting on the skin for too long, or could it be a pressure related injury? You can just press gently, just as if you were to do, for example, a capillary check. You would basically just be gently pressing on the area of redness. If it stays red, then it's a pressure issue. If it blanches, in other words, if it turns white and then turns red again, then it's going to be pressure related. Now, a stage 2 is where the skin has started to open. You'll see a reddened area or a pink area in the wound bed. You haven't started to see any yellow slough or eschar. Between stage 2 and stage 3, I find this is where most people have the hardest time with the different stages. The easiest way to think about it is stage 2 has a red or pink wound base. It doesn't have any debris in the wound. And then when you get into stage 3, that's where you're starting to see some of that adipose tissue, some of the yellow slough or the black eschar that might be in the wound bed. And then once you get into stage 4, that's your underlying structures. So you might see some bone exposure, some tendons, some ligament, any underlying structures that shouldn't be there indicate that you have a stage 4 pressure injury that you're dealing with. And then in terms of a deep tissue pressure injury, it looks often like a bruise. And in theory, that's very similar to what it is. The blood vessels underneath the tissues have opened. You have skin damage that goes much deeper than you will actually visually see from the outside, because often what happens is the outer tissue stays closed, but you can see the patients develop those more blistered areas. And then you also have your unstageable wounds. And those unstageable wounds end up turning into either areas of eschar or areas of yellow slough that are very hard to determine how deep that wound is underneath. It doesn't mean that it's completely black or completely yellow, but enough of the area must be either or for you not to know how deep that wound is if the tissue was to come off. And that would be considered your unstageable pressure injury. Now, in terms of risk factors for developing pressure injuries, obviously things like sensory deficits where they can't tell if there's a long-term area of pressure. For example, in your diabetic population, if they have neuropathy, they don't have a great feeling in their feet and lower legs. If they're staying put, or in the instance of a critically ill individual where they might be sleep for lengthy periods of time. When their heels aren't moving, it's a much higher risk for them to develop, for example, a heel pressure injury. And it's really important that when you're caring for these individuals, that you're looking closely for any sort of skin changes, especially the initial skin changes, like those stage 1 pressure injuries or those reddened areas, so that you can catch them early before the tissue starts to break down. Also, of course, individuals with altered mobility, like we talked about, compromised nutrition. Whenever an individual isn't getting the amount of nutrition that they need, nutrition plays a huge impact on wound healing, whether it's the protein that assists in the wound healing, or a lot of the different vitamins and nutrients that individuals need on a regular basis for appropriate skin health. If they're not getting the amount of nutrients that they need to heal that wound, then there's nothing that you can really do other than making sure that that wound is not getting worse. The other piece is preventing increased exposure to pressure and shear forces. And that goes back to what we talked about earlier, especially with skin tears, of making sure that you have extra assistance whenever you're boosting patients up in bed, turning and positioning them. You never want to be dragging any individuals along the bed when you're moving them. And you always want to make sure that you're positioning your patient in a way that takes them off of bony prominences that are at risk, or moves them back and forth on a regular basis. You should always be turning your patients every 2 to 4 hours to make sure that that pressure doesn't develop, especially in individuals who can't do it themselves, such as in that critically ill population. And speaking of using pressure redistribution devices, and you see that a lot, whether it be mattresses, cushions, offloading boots, or cushions that take the pressure directly off heels, or takes the pressure off of the coccyx area, for example, depending on your turning and positioning system that you may have available to you. Also, using soft silicone multi-layered foams over bony prominence can assist with some pressure redistribution, but it also assists with reduction of pressure and friction issues that can lead to pressure injuries developing. Making sure, again, that you have that skincare routine in place. And I'm starting to sound like a broken record here in terms of making sure that you're appropriately applying good skincare routines on a regular basis for these individuals, making sure to clean using a pH balanced skin cleanser, and then making sure that these individuals are well dried, and then apply some sort of barrier to protect that skin from any breakdown or further breakdown around that area. You can also consider using the textiles that we talked about with low friction coefficients inside of any skin folds or other areas where they may be at risk for pressure injuries developing. And then optimizing nutritional intake, as I mentioned, is extremely important. Now, we already talked about the importance of offloading the heels, taking pressure off bony prominences. We talked about the importance of, or the idea that you can also use those multi-layer foam dressings to reduce that friction and shear, as well as a bit of the pressure, and just making sure that if you do decide to use any sort of heel offloading devices, that you're keeping an eye on those heels and the rest of the leg on a regular shiftly basis, just to make sure that you're not noticing any skin changes. You, of course, want to make recommendations in regards to the dressing according to local wound bed. For example, if there's increased bacterial load, you want to use an antimicrobial. If there's increased drainage, you want a dressing that's going to manage your drainage. It goes back to those standard time or dime principle paradigms where you're monitoring for, do I need debridement? Do I need infection inflammation management? And do I need moisture control? And if so, what do I need to add moisture? Do I need to remove moisture? Those go back to those three common things that you want to consider when making a choice with regards to a dressing. Now, in terms of device-related pressure injuries, we had started talking a little bit about this previously. You see this a lot more frequently in the critical care areas, just due to the sheer number of tubes, due to the sheer number of devices that are used in this population, whether it be masks, oxygen tubing. You can see in the top right-hand side where this individual developed a pressure injury around the trach. So there's a number of different devices that are used within critical care areas that put these individuals at a much higher risk. Now here you can see a little bit more about device-related pressure injuries. Anyone with a medical device is at a much higher risk for obtaining a pressure injury. These pressure injuries usually take the form of the actual device. So you'll notice if you think back to, there's a little picture there, but if you think back to that picture I pointed out of the buttocks where the catheter had actually formed that channel, that's a good example of how the wound will actually form to that device. And you saw in the prior picture, I'll actually go back, with the picture of the child on the bottom right, how the actual mask had started creating a stage 1 pressure injury just around the face, just from having it sit on the face for so long. So really important to be keeping a very close eye on these areas. Some of the things that you can do to prevent issues from occurring: make sure that you're choosing the right size of the medical device, make sure that it's well fitted to the patient. Again, going back to that, keeping that skin clean and dry, making sure that there's an appropriate barrier there. You can use a prophylactic dressing. We'll be talking a bit about that more later, and you'll see that especially when Kim starts talking about some of the prophylactic dressings that you can use when proning patients, for example. And it's really important that you're avoiding those excessive layers, and that could be excessive layers of clothing, it can be excessive layers of product. Anytime where you have a lot of layers, it's increasing the amount of pressure in that area of tissue. Now, in terms of other prevention strategies, making sure that you're routinely changing dressings so that you can keep an eye on what's happening underneath them, rotating oxygen masks, repositioning the devices, simply moving the device, even just slightly, takes the pressure off the area that was on it previously. Also, just making sure that you're rotating the site if the site can be moved, such as like an endotracheal tube placement, making sure that it's not always being placed in the same exact location if possible. Or you can see, for example, in the picture over to the right-hand side, how you can start getting some mucosal pressure injuries develop if the tube has stayed in the same area for a longer time. And it's really especially important to note any areas of swelling underneath the device, because this can also indicate a higher risk for or the start of some tissue breakdown occurring. You want to make sure that you're not obviously placing the patient right on the medical device. So making sure that when you're turning and you're positioning, making sure that the medical device is going away from the patient or through their legs rather than underneath. Making sure that you're taking the patient off the bedpan as soon as possible, and just if you have an opportunity, educating your staff and your colleagues on the proper use of devices if you have that opportunity. All right, and with that being said, I'd like to say thank you all for listening, and I'm going to turn it now over to Dr. Kim LeBlanc to talk about skin integrity in the prone patient.
Thanks, Corey. So now I just want to switch gears a little bit and talk about the prone patients. And, a lot of what Corey has just said is very, very applicable to this population. But there's a couple things that, we need to be aware of. And that is, it produces so much extra stress on these patients. So with any acute respiratory distress syndrome, COVID-19 being one of them, patients are often placed in that prone position. And just to give you a bit of background, the reason that we do that is that it gives improved oxygenation. It allows the lungs to further expand, and it really increases the rate of survival. but we know that it increases skin vulnerability and breakdown with all of the factors that Corey just talked about: pressure injuries, device-related pressure injuries, moisture-associated skin damage, skin tears. All of these are higher in individuals in a prone position. And we know that, for instance, pressure injuries, their risk can increase by almost 30%. The interesting part is the fact that we don't know if where those pressure injuries will be, because often they'll be in areas where we never suspected it. So I'm very happy to have been part of this program, which is the Skin Integrity in Prone Patients PRONEtect project. And this is part of the doctoral work of Annika Fournier, who's working under the direction of Professor Dimitri Bickman out of Ghent University. And you can go to it's SKINT at ughent.be to get more information. And you can download all of these working documents and use them in your practice for free. And so this is going to be published into a much larger document. But what they have done is they've gotten a group of us from around the world. We work together, but basically what Annika has done is that she's really pulled out some of the valuable things we need to think about when we're looking at prone patients. So some of the things she talks about are looking at pressure points, looking at medical devices, looking at skin moisture, realizing that skin moisture, it can occur in places we don't necessarily think about. So for instance, you can have moisture that develops in skin folds, but also under the abdomen, in around the genitals, in areas that we don't necessarily always check for increased moisture, although I have to say we should. And we also have to realize as well that COVID-19 is giving us something else to think about, and that are the skin manifestations related to COVID-19. So that just throws another little curveball into the mix. So this is Julia Bresnay-Harris, and Julia is one of these amazing unsung heroes, and we've had a lot of conversations over the last year and a bit, and she's allowed us to share her story with you. And, this is what, after the end of a particularly long day in the ICU, she was seconded to the ICU. She's a tissue viability nurse in Charing Cross in London, and she's an NSwoc from Canada. And she said that some of the things she found were that her patients were very unstable, that in their ICU, they hadn't seen proning to the degree. And so we came back and we talked to the ICU nurses here in Canada, and I'm not working in ICUs anymore. So I went out and spoke to the nurses, and many of our NSwocs have been reallocated to ICU as well. And they said the same things, that they were seeing proning at very high levels. And the problem is that these prone patients were so unstable that they couldn't even do the slightest movements without them desaturating and having problems. So in order to reposition them, you need an entire proning team. And so this became a problem. And because proning isn't done that often, and because they had to shift so quickly to proning so many patients, sadly, their proning guidelines didn't include skin care. And we know that in some cases, prone patients are up to 24 hours at one time for over 300 hours, some of them in total. And as well, because our nurses are so overburdened and overworked, they're actually not having time to complete incident reports when pressure injuries or other skin breakdown does occur. So if we take a step back and look at proning, we already talked about this, that we have prolonged proning and that it brings us multiple challenges related to skin integrity, and that prone patients are at 37% higher risk of developing a pressure injury. So we need to really think about that when we go back to our populations, that we need to think about how, if we're proning a patient, where can skin issues happen? So this is some photos that really demonstrate some of the pressure injuries that can occur in prone patients. So you can see on the right-hand side, you have the individuals that meet with pressure injuries on their knees. You can see lines across their thighs from the bedding underneath them, as well from their medical device. And then you can see the other individual's abdomen, where we have deep tissue injury on their abdomen as a result of having a larger abdomen and being in a prone position. So these wounds can be quite traumatic, they can be painful, and they can take a long time to heal. So if we're looking at some of the key points to consider, first you need to think about where are the pressure injuries? Because normally when we think about pressure injuries, we think of over bony prominences. But when we're proning patients, those areas may change. So you can see we have the forehead, the cheeks, nose, under and around the medical devices that we're going to use to intubate the patients, their chin, the clavicle region, their elbows, their breasts and rib cages. You know, we often don't think about the fact that you could develop pressure injuries on someone's breasts. And then there's the genital area, the penis. I unfortunately have seen a few patients who came out of hospital after being proned who had very horrible pressure injuries on the penile area and on the scrotum. And then we have the pelvic bones, the knees, the tibial crests, and the dorsal side of the feet and toes. And you have to remember, we've all heard in the news about COVID-related issues, such as the microclotting that happens that leads to COVID fingers and toes, where you can have microcirculation damage. Well, if we have decreased circulation because of small clotting to the toes, and then we add in pressure, we can have a really horrendous wounds that develop. And there's been many stories come out of patients who've survived COVID but have lost limbs in the process. So some of the things we really need to think about is before we prone a patient, we need to think about eye care. We need to make sure that we're lubricating their eyes, that we're closing the eyelids with either a microporous of silicone tapes horizontally, making sure that the eyelashes are face forward. You know, certainly the ET tube holder that we normally would use, we want to replace that with tape so that we don't have any hard area. Placing foam underneath the ties. And you'll hear a lot about using foam dressings prophylactically. And that is something that's very important. There's been a lot of buzz in the literature of late around using that multi-layer silicone dressings to offload pressure. And it is very important because, especially in the prone patient, because we need to offload any pressure that we can, we need to look at that shearing and friction, and we need to look at moisture control. We may want to look at using alcohol-free liquid barriers or cyanacrylates. We want to use the lowest level of adhesive that we can. We want to make sure that we protect other high-risk areas with those multi-layer silicone adhesive foam dressings. So looking at the knees, the dorsal part of the feet, over the iliac crest, the breast and the clavicle areas, and the forehead. Don't forget the forehead and the cheeks as well. We had one patient who came back with a large circle in the middle of their forehead that was the result of being proning. So we need to look at thinking before we prone our patients and think of where those pressure points can be. So this is just another example of the pressure points, just to really bring it home to you. And all of this, as I said, is in that PRONEtect document that you can download. And I can't stress enough the need to really protect around medical devices as well. And we encourage the use of a lot of the silicone foams around those devices because they do a good job of reducing shearing and friction and controlling moisture. So the idea is, if possible, we try to get the specialty beds that are designed for proning patients. And most of the intensive care units do have these beds readily available. The problem is that because we've had overflow ICUs, we've seen recovery rooms turned into ICUs, we don't always have enough of these beds in the hospital. And so this is where we need to get creative with pillows and wedges and other devices to make sure we can offload those areas. And another important thing is we really need to do that comprehensive skin assessment before we prone. Every position change, we need to be looking to make sure that we're checking for any redness or signs of MASD or pressure injuries, skin tears, and we need to act appropriately and fast. And we need to make sure that we're documenting. So we're looking at the face and head. Some of the things that we recommended in the document Corey was talking about was to making sure you protect the face with a liquid skin barrier wipe. Don't use the sprays or around the eyes or trach ties, obviously. and to wrap that endotracheal tube with silicone-based foam at the teeth line. So right here along your teeth or jaw line. Use the tubes, use ties rather than the harder stabilizing devices while they're prone. Once again, making sure you're protecting the forehead, the cheeks, the corners of the lips, and the chin. And to apply that soft silicone foam or silicone transfer foam on any pressure points, as you can see in the document. And you can see here we've used one of the dummies at Corey's hospital to show you how we go about preparing those patients. Making sure that we're really offloading pressure from the head, face, and ears. Don't forget about the ears. Too often we will come back from the oxygen tubes and we'll see pressure points around the ears. You know, if they're stable, changing position as much as you can, maintaining proper eye care is so important. We see a lot of people who get corneal abrasions from the eyes drying out. So it's really important that we make sure that we tape the eyes shut, but we don't want to cause any trauma to those eyelids. So you need to make sure you're using a microporous tape or a silicone tape. And don't forget proper oral care as well. Patients will come back with huge sores in their mouths just from not having that proper oral care. And as we've already talked about, when we start looking at the torso, elbows, knees, legs, dorsal feet, and breast, we need to think about offloading and protecting, making sure that we're using those silicone layered foam dressings prophylactically, but also looking at the other devices that we're using, like EKG leads, making sure they're on the back. Too often, we'll have patients that'll come back from hospital and they still have EKG leads all over their chest, right? So just because you've unhooked them from those leads, remember to take off the leads before you prone them. Making sure that the ostomy pouches are emptied and monitored, and check the stoma for signs of trauma as well in that prone patient if they have a stoma. Secure all medical devices away from the skin. Think about catheters and different tubes, monitoring tubes and like we use. Make sure that it's all possible that we offload and protect. And, once again, the genitalia is something that we can't forget. As I said, we've seen a few horrendous issues. So make sure that you're really protecting them, ensure that urinary catheter is stabilized and that no devices are left under the prone patient. So proning patients aren't easy. So we need to think about how we're moving and positioning patients. This is not something you can do with just one or two people. You need to have an entire team. We recommend at least 5 to 7 people. And in most proning teams, they have one person whose sole responsibility is the airway management. So it takes an entire team. And certainly we advocate to have an NSWOC present to help with the skin assessment and to make sure that offloading is done properly. It's not always possible, we understand that. So this is where we need other nurses to jump in and make sure that the skin is being protected. Changing the position of even just changing the position of the head, at least we could offload some pressure from the face. It's not always possible. If the person can tolerate it and they don't desaturate, then at least we change some body positions. So sometimes we can do the swimmer's position where we kind of change the arms, check the ankles areas for pressure damage, check as much as you can. Even little micro shifts can make a huge difference for offloading pressure. So it's part of the document that they put together out of these PRONEtect team was they gave you a checklist that hopefully will make things easier for you when you're looking at changing positions and taking care of prone patients. And this can be downloaded, as I said, from the Skin2Gent website. So we do have an article that's coming out where we're going to be looking at the management of critically ill patients in the prone position. And this is really to look at all the literature that's out there, and it should be coming out very shortly because we finished the review. Something else I wanted to talk about just briefly is individuals receiving vasopressors. So vasopressors are drugs, for those of you who don't work in intensive care, they're drugs that are given that result in vasoconstriction. And we've we give these in critical care patients to increase their mean arterial pressure. So what happens is fluid shifts from the extremities to the central area, and this causes the MAP to rise. And this is very important. It's life-saving. However, a secondary and very unwelcomed side effect is that we can get skin changes and ischemia to the hands, feet, sacral area, ears, and the tip of the nose. So if you're looking on the sacral area or heels, it often presents deep purple in color. It resembles deep tissue injury, and it can be with or without bruising. Hands, ears, nose, feet, toes, these present as really poorly demarcated, deep purple blackened tissue. And they can go on to become necrotic. And we have had individuals who've ended up losing fingers and toes, tips of noses, and things like that. The degree of tissue damage is going to depend on their patient's overall condition, their comorbidities, and how long the high level dose of vasopressors are needed. But, keeping in mind that these are life-saving medications, but if you see any of these issues, they may be unavoidable, but please make sure that you consult with the greater healthcare team. This is a team effort taking care of prone patients. So please make sure that you report these type of injuries immediately. And if you're an intensive care nurse and you're transferring a patient to another service, please make sure that they are aware of any skin issues. And if you're a nurse who's receiving a patient from an acute care hospital or from ICU into your unit or into community or long-term care, please ask the question of, were they in intensive care? Did they need proning? And were there any skin-related issues? Ask the question about skin health. So, one of the big things that's managing these types of patients is making sure we have maximal hydration. Sepsis can be a problem, so we need to make sure that is ruled out. Offload the pressure from the areas so that we can minimize the trauma. Using heel boots and appropriate pressure redistribution mattresses if we can. Good skin hygiene. Protect, protect, protect. That's the most important thing. Inspect the skin and document, make sure everybody's aware, and just offload the pressure and protect the area. So there's some key points that we wanted to leave you with. One, COVID-19 is an emerging illness. Its full impact on the skin is not known, and we're constantly getting new information emerging. But what this is shedding light on for us, if we try to take one semi-good pearl, I guess, away from it, is that we're starting to have a greater awareness among healthcare professionals about the impact that critical illness can play on the skin of these individuals, resulting in skin tears, moisture-associated skin damage, medical adhesive-related skin injuries, pressure injuries, and device-related pressure injuries. And often these kind of wounds have been overlooked in the past, and this is really shedding light on this. So, we know there's a lot of challenges, but these are the kind of things we need to be aware of, and we need to document, and we need to talk to each other so that we know that these issues are happening and do our best to prevent them. So at this, what we're going to do now is we're going to open it up for a few questions. I will stop sharing my screen here. And we'll open this up for questions. So if you have questions, you can put them into the chat box, or into I prefer if you do the question and answers if you can. We are a little bit over time, so but we will, I think Corey will stick around for a few questions if anybody has any. So we'll get started. We do have a couple of questions there, Corey. So I'm going to start throwing some to you. So one of the questions is, when you're looking at taking care of patients with wounds and potential to develop wounds, what would you recommend as a barrier?
So I think that's a really great question. And I think the most important piece, and we didn't necessarily, in the best practice document, we didn't necessarily speak to any product specific different barriers. I would say that the most important piece is that you're using a barrier and using it according to what the manufacturer guidelines are. So I would say whether it's a dimethicone skin barrier, a zinc-based skin barrier, it really depends on the amount of tissue damage that you're seeing, and it also depends on how often you're reapplying applying it. For example, if you don't have some of the higher end skin barriers, such as like a dimethicone skin barrier or even a zinc-based skin barrier, you do need to be applying like a regular moisturizer more often, just making sure to keep that skin healthy and prevent it from breaking down.
Yeah, I think that's a really good point. And, maybe we shed a bit of light too, if we put on our continence hats for a minute. One of the things that's really important, Pearl, to take away is that if you're going to be using any type of a barrier, such as a petrolatum-based skin barrier or zinc oxide or dimethicone, make sure that whatever you're using is compatible with your absorbent product. So for instance, far too often I'll get called to see patients who have severe incontinence-associated dermatitis, but they're putting on zinc oxide about 2 or 3 inches thick on their buttocks and perineal area, and it is clogging all the pores of the incontinence product, and the moisture is basically just collecting and sitting on the skin. So you're taking away the benefits of using that product to begin with, and you're actually making the problem worse rather than better. So I think, it's something that we see every day. We'll have time for one more question, and trying to put a couple of questions together here. Looking at intriginous dermatitis, any tricks for managing ITD in a prone patient, Corey?
Oh, in a prone patient, that is a great question. I mean, in theory, the idea is still similar to the non-prone patient in that you just want to make sure that you're wicking that internal moisture. Like the tricky piece with the prone patient is because the skin folds are much deeper, they're harder to get to. They're on the area that's being covered by the patient being prone. I'd say that you still are able to use wicking products. You just need to make sure, again, you're using them according to manufacturer recommendations, which is usually that you're allowing a set amount of product outside of the skin fold so that it can still be wicked away from underneath the skin fold. That, and also there's a number of newer dressings that are actually being used for intertrigo specifically, that are basically meant for moisture in the area. It focuses more on moisture absorption than it does the wicking away, like the textile products that we talked about. And if you choose to use those type of products, it's just important that you're making sure that you're changing them and assessing them regularly. And then going back to what we talked about with the importance of like healthy skin, making sure that you're cleaning, drying, and adding some sort of a barrier so that that moisture, if it does develop, isn't sitting directly against the skin.
Yeah, I think that's a really good point. And, one thing that we do see is that there's a lot of home remedies out there for managing ITD. So please don't use cornstarch. Don't use any of the talcs because they're actually known to increase the growth of bacteria, fungal infections. Wicking away, I think, is the most important thing. And if you're going to use some of the absorbent products, and as Corey said, you need to make sure you're changing them on a regular basis and keeping in mind that, when we're looking at some of the tricks, like people put pieces of flannel and face cloths and paper towels, you name it, people will put them between skin folds. And while some of these products may absorb the moisture, they don't wick it away. And it's the wicking away part that's so important. So I'm a big fan of using textile products for wicking away. There are some dressings, as Corey said, that are absorbent that will do some wicking away if you use the longer sheets of them, but you need to watch very closely. And, the big thing is wicking away and dealing with the dermatitis as well. So quite often, there's a question now, it just popped into the chat saying someone's constantly laying on their left side and under his arm has developed severe redness. So they developed intertriginous dermatitis on that left side under their arm. You need to use a topical steroid to treat the dermatitis, but at the same time, you need to make sure you're wicking that moisture away and using a barrier protectant. You can use a cyanacrylate or you can use a dimethicone-based product. So it's very important that you do look to make sure that you're dealing with kind of it from a multifaceted standpoint. At this, we have gone 15 minutes over, so I do think I have to cut it off, but I would like to, thank everybody for joining us this evening. Corey, thank you so much for giving us all your wisdom. And once again, I'd like to, shout out to all of the NSWOC team who helped us, put together these documents. And thank you to Monica for sponsoring this presentation this evening. Nicole, is there anything you'd like to say in closing?
Sure, I'd just like to thank Kim and Corey for wonderful presentations, and thank you all the participants who took time from your evening to participate. The recording will be available on the NSWOC website, so if you have colleagues you think will enjoy this presentation, please guide them to the NSWOC website. And I wish you all a great summer with lots more freedom than last year. Good night, everybody.
Good night, everyone. Thank you.
Good night.